In communicating with my patients, part of it's playing. A lot of the neurologic examination for an infant is just observation. So from the time I come in a room and start saying hello and talking to the parents, I'm doing an exam. I'm watching how the child interacts with his or her mother or father, looking at his or her language skills. I'm looking at whether he or she is moving both sides of the body equally. But part of it is then getting on the floor and playing. The toys are my best tools. They're more important to the neurologist, the child neurologist, than the reflex hammer. But I also communicate using humor. I like to walk in the room telling a joke. A lot of the kids and parents come in quite nervous, and hopefully this relaxes them. But it's also part of my assessment. Does the child understand the joke? Does the child laugh? Does the child respond to me with a joke? And that's, I think, an important part of the cognitive assessment, which is something major that we do. And it's just like playing with a child, checking reflexes, checking vision. One of the best days I've had here was an afternoon. It was the end of clinic. I wasn't in a big rush. It was a teenage boy with cerebral palsy, and the mother and I dealt with the medical issues. But then we started talking about how having him as a son has affected her life, how it's affected her marriage, her interactions with her friends, her career, and this conversation went on and on and on. It really didn't solve any problems. It didn't check any boxes off this checklist that we keep of things we need to do. But for me, it was one of the most satisfying conversations I've had. I went home feeling good, and I think she did the same thing. And it's something I try to do with as many patients as I can. We don't always have the time we need, but trying to help them live their lives as best they can is very, very beneficial, and it makes me feel wonderful.